Now, the Labour Court is expected to rule if NEHAWU-led public sector strike can go ahead. The union has applied to overturn an interdict against the mass action. The week-long strike has disrupted some government services, particularly at hospitals. As Mr. Joe Pahla is addressing now, let's listen in quickly.
Who were disadvantaged. But in terms of people who died as a result at this stage, we'll get the report from the medical staff, but not at this stage. We don't have such a report.
Can you please just clarify the profile of the employees that are on staff? I know that you've said it right now, maybe the NEC can help us with that as well. It's really important for us to say that is it more admin staff specifically, and not so much the nurses and the doctors?
Yes, it's the admin staff, because we have only 2 now that on that side besides the manager, so it's 3 with the manager, so we're affected in that area. But our intervention, I think it has helped, and we will be bringing more staff that must assist them, so that it's our contingency plan that we're going to do, so that we don't rely and think that the guys that are outside will come back. So we're planning for that now.
Well, you asked about nurses. I think we also getting nurses from other facilities, because it's admin and also nurses. In fact, the main target of the people who have been stopping people from coming to work, main target has been nurses. Of course, the admin as well. So the doctors, I don't know whether it's because doctors are not members of NEHAWU. So the doctors are in good numbers. It's mainly admin and also other support like cleaners, porters, that in that area of work.
Sorry, could I ask something? Can I go? I just want to understand something. So when you say it's nurses, is it because, I'm just trying to understand the staffing situation, is it because these nurses and doctors or whatever it might be are on strike, or because they are being intimidated and they are scared to come? We also saw a bus of, I think it's student assistants from WITS. Have you called them in to now assist you because of the staffing issue?
We're bringing everyone that can assist us, Haida, and everybody is prepared to come. I'm sure I know HOD was arranging that we must get our interns to come and assist. So they will be including even EMS guys, they are going to assist us. So everyone that is prepared to come and assist the site, we're bringing them. But nurses, we're taking nurses even at JD to Money Clinic, because it's just 1 kilometer away from us. We'll be servicing them this side. So, because we have a shortage of nurses indeed, and nurses are members of the union, most of them. So hence the problem. But I don't think, we didn't get any case that they were intimidated. I think they are staying away because of the strike, not because somebody said they must not come.
Well, maybe MEC, just to qualify to say, remember some are NEHAWU, others are DINOSA. So DINOSA has been complaining that their members want to come. I'm sure you heard them even publicly, but that we must sort out the security. So, and we know that almost everywhere, the primary target, those who were actively discouraged and told not to go in, were nurses. I mean, just typically at Charlotte on Tuesday, on Wednesday, the few nurses who came in claimed to be doctors, so they were allowed to go in. But once you say nurse, they say no, nurses don't go in. You see, so, and it doesn't matter whether you are a DINOSA or you are NEHAWU. They just said no nurses must come in, no admin, and only if you claim to be those nurses who were wearing like doctors. Once the nurses knew that if you wear doctors' attire, you are not going to be blocked, then they were able to go in. So there will be some, because NEHAWU also does sign up nurses. So there will be some who are not here genuinely because they support the strike. But I'm quite convinced that the reason why, when security improves, you have more and more nurses coming to report is because of the fear. So we believe that even today, as I'm saying, we haven't tallied the numbers because we had to address the immediate thing of the pressure for the services. But the fact that a number of areas are quite, are taken care of by nurses. So it does give an indication that even the attendance by nurses today is much better.
Can I ask one more question? You said the hospital is not operating at full capacity. Are you able to give us a percentage as to what capacity the hospital is operating at?
Well, just from the inpatients, this hospital has a capacity of 800 beds. And as we speak now, it's about just under 320 patients who are in the wards. So just less than half in terms of the admitted patients. But clearly, in terms of the outpatient services, because over the course of last week, there was virtually no service. So that's why you see a lot of hundreds of people today. So the outpatient side, people who need medication, who need to be checked up, the antenatal section is full. You know, women who were due to have their pregnancies checked, they are full. We're bringing more nurses so that because the nurses can do most of the checking of the antenatal. So from that point of view, it's quite possible that by the end of this week, the outpatient services will probably be at 100%. But I think we have to be cautious on admissions because we need to be sure. You can't increase the people in the wards if you don't have enough nurses, if you're not sure that the food, that the kitchen will be operating full steam. So there are those kind of things which will have to be checked. I think we'll have to be cautious in terms of those who can be diverted to other hospitals for admission, but at least they will have been seen. So that's almost like just below 50% in terms of inpatients. But I think I'm not sure about the daily outpatients, but clearly today is quite cumulative for those who were not seen, were not attended to last week. So you're likely to get more stability on outpatients, and the ones in the wards will get more once things are really very stable.
Thanks, Minister. My name is Longane from KCFM. Minister, are we going to see the department making an investigation in terms of finding the actual numbers of people who passed away across the country? In this hospital alone, there are allegations that there are more than 8 children who passed away at emergency care unit due to the strike. Are you going to be transparent about the actual numbers?
We definitely, we're obliged by law because, if people die in hospital, there must be a record, and there must be, if it's in the situation where, especially where the likelihood of what we may call unnatural, in the sense that people who otherwise, if they had medical care, they could have survived. So we have to have those records. It's compulsory that we must have the records. As to whether we'll share them with you, that's another question. We are obliged to have the records, but once we have established the linkage, the definite linkage from the clinical side to actual cause of death, then at some stage, once that is reconciled, we will be able to share with the public. Yes.
From Newsroom Africa. Just on a point of clarity, both to the MEC and to Mr. Minister. These facilities that we're here, is it the only one that's affected in Gauteng? What is the situation in other facilities across the province, and what is the national picture? You've painted a picture that, just over under half of the beds here are available at the facility. Is this the general picture across the nation, and what's the way forward? Are you closer to each other with the union?
All right, those are live visuals then for Slurus, where Minister Phaahla has just concluded a walkabout. They have indicated that, in fact, there is a significant shortage of nurses, but they'll be bringing in EMS staff as well as interns to assist, and where possible, they'll be diverting some of those patients that would have ordinarily been coming in.